Okay, so let's talk about sacroiliac joint belts, also known as SIJ belts. What are they? What do they do? How can they help? So we have to look at what the sacroiliac joint is, and it's the area of your pelvis. You have two pieces of your hip bone that actually end up getting met together with your sacrum. So you have your ilium and then you have your sacrum, and they form this kind of like elephant ears position if you look at a skeleton. What does that look like with someone who has skin and organs? It's going to be this, say, if you pick your leg up, you have your hip bone right here, but then if you go just north of that, we have what is called your crest. And then if you bring your hands out into the front, you're gonna have these hip bones, and we call them the ASIS, anterior suprailiac spine. So these are some of the landmarks that you want to be able to keep an eye on. Ideally, it's going to be pretty much between your belly button and your pubic bone. That is actually where your pelvis is. And in some cases, you might have a little instability between those bones, which can result in just localized pain, kind of localized butt pain. But also, if there's a little bit of instability or too much motion or abnormal motion in that area, the muscle surrounding that area, the hip joint, can get irritated. So we're looking at glute issues, piriformis issues, deep butt issues. But what runs deep to those muscles is your sciatic nerve. And so the SI joint belt is going to restrict motion, but can also provide a little bit of gapping and distraction, which would allow the hip joint and the pelvis to move a little bit more ideally. So how can we do this, right? And so the idea is that you can go online, find all these really expensive, complicated different belts, or you could just get a belt that you can simply tie around your waist. Now here I have a braided leather belt, but you can use a canvas belt, whatever you'd like. And the idea is that you're gonna be placing it along a couple different areas, and you can experiment and see which area is the most comfortable. Number one is going to be the crest of our hips. So it's going to be kind of like maybe at the belly button or slightly below. So if you put your hands together, you would kind of press to the point where you can't press anymore, and that's your bones. It's like you have your ribs, and then you have flesh, and then you have your crests. And then once you have your crest, you can actually find that area, and then you can go ahead and put it right at the level of the crest and loop it through, and then apply a little compression at the crest and see how that actually feels in standing. Now you want to apply pressure just so that it's kind of like a firm, like someone were to grab onto your hips. You're not looking at crazy restriction preventing movement of the rest of your body. So we have the top of your hips, aka your crest. The second area is actually going to be at the level of your ASIS, these hip bones in the front. So it's going to be a little bit lower, kind of as if you were to be sitting your actual belt around, and you can apply a little pressure in that way as well, and make sure that you are in fact pressing on the bone itself. So if you realize that there's maybe a little bit of give, you might actually be a little too high because you feel like you're really more so squeezing flesh versus compressing the bone. The third area is going to be a little bit lower. Not necessarily like your hip bones, because that's going to cause a little too much restriction, but maybe just north of it. And you're going to go ahead and put the tension on and see how does it feel against your body. How does your body feel as a result? Does your butt or anything feel any different? And you can, once you put it on, you can see what it's like when you sit down. You can see what it's like standing up. You can see what it's like walking around. I would say try it out and see the tension, what tension you can tolerate. Again, less is more, so you don't have to pull to the point where you're creating a significant amount of tension, but just enough for support. And it feels great, then you can go ahead and spend maybe 30 minutes to an hour wearing it, but then taking it off, giving you an opportunity to reacclimate yourself and allow those muscles to reintegrate again. And so this is an opportunity to create a little bit of inherent stability in your pelvis, which can actually make it so that your hip muscles don't have to tense up as much, which then can irritate a little bit further down the chain in regards to, say, your sciatic nerve or any other issues.